I am Samkit Jain, a medical student at Mindz National Medical University, and I am an Inspiring Mind student. And here I'm back with a new video of my anatomy series that is basically the continuation of the previous topic. In the last video, I discussed about the different branches of the brachial plexus, and in this video, we'll be discussing about the injuries related to the brachial plexus. And guys, I'll continue to bring such erudite videos for you. For that, you can subscribe to our YouTube channel and follow us on Instagram at Inspiring Minds Coaching. For better revision of the topics, you can also join our Telegram channel. You'll be getting all the links in the description. Now let's start with the video. So the first injury that we are talking about is injury to long thoracic nerve. Now, injury to long thoracic nerve, as we discussed in the previous video, arises from the roots of brachial plexus and has root value C5, C6 and C7. And injury to long thoracic nerve leads to a condition known as winging of scapula. Now, this long thoracic nerve can be is usually injured basically in mastectomy. Now, what is mastectomy? Mastectomy is the surgical removal of the breast. So it is usually injured during mastectomy. And it leads to winging of scapula. Let's see an image here. You can see that due to the injury to the long thoracic nerve, the scapula, it seems that as if it has protruded out. This is known as winging of scapula. And to know whether it is preganglionic or postganglionic, to know whether this injury is preganglionic or postganglionic, if it is associated with Horner's syndrome, then it is preganglionic. If the winging of scapula is also associated with the Horner syndrome, then it is preganglionic. Now, what is Horner syndrome? For that, again, we have an image here. So, Horner syndrome is basically sympathetic loss on face. When there is sympathetic loss on face, then it is known as Horner syndrome, and it has many manifestations like there is anhidrosis, that is no sweating on the face, that is known as anhidrosis. There is miosis, there is ptosis, that is drooping of the upper eyelid. That condition is known as ptosis. There is pupil constriction, and that is known as miosis. Constriction of pupil is known as miosis. Plus there is enophthalmos. There is loss of ciliospinal reflex. So this is your Horner's syndrome. So if winging of scapula is associated with the Horner syndrome, then the injury is preganglionic. Now, another one. Now, we have two palsies related to the brachial plexus. Okay, first of all, assume that this is the brachial plexus. Now, if there is injury to your C5 and C6, if there is injury to your C5 and C6, then it is known as Erb's palsy. And if there is injury to C8 and T1, then it is known as Clomp Klc palsy. Erb's palsy and Clomp Klc palsy. Now let's study each one of them. First of all, we have Erb's palsy. In Erb's palsy, your C5 and C6 are affected. And what are the causes of Erb's palsy? Why does this damage occurs? When you fall on an outstretched hand. Fall on outstretched hand. This leads to your Erb's palsy, because when you fall on an outstretched hand, suppose from a horse or from a motor bicycle, then it leads to the displacement of the head of your humerus, and therefore it leads to the injury. And suppose it may be during the delivery, difficult breech delivery. So these are some causes of the Erb's palsy. Now, what are the manifestations? What happens in this basically? So in Erb's palsy, as I said, that C5 and C6 are affected. Now, the major nerves that are affected have a mnemonic arm. That is, your arm nerves are affected. That is axillary nerve, your radial nerve, and musculocutaneous nerve. So these are the three main nerves that are affected in Erb's palsy. You can remember them as arm nerves are affected. So axillary nerve, the root value of axillary nerve is C5 and C6. Therefore axillary nerve is completely gone. Now root value of radial nerve is C5 to T1 entire. Therefore only C5 and C6 part of radial nerve is gone, and C7 to T1 is spared. Therefore there will be not much injury to the radial nerve. And if we talk about musculocutaneous nerve, the root value is C5, C6 and C7. Therefore C7 part will be spared, and this C7 part is supplying the coracobrachialis muscle. Your musculocutaneous nerve supplies BBC muscles of the arm, that is biceps, brachialis and coracobrachialis, out of which the C7 part is supplying coracobrachialis. Therefore your coracobrachialis is spared, but biceps and brachialis will be affected. Now let's see that what will happen due to the injuries of these nerves. Now, since your axillary nerve is affected, therefore axillary nerve supplies two muscles, deltoid and teres minor. Let's take deltoid muscle as the major muscle affected. Alright, since deltoid muscle is affected, it helps in the abduction of your arm. Your major abduction of the arm is done by deltoid. Therefore there will be no abduction. Your arm will be adducted. Adducted arm. Adducted shoulder. Now radial nerve. The C5 and C6 part of radial nerve supplies brachioradialis. There will be not much manifestation, but remember that any injury to radial nerve, it is at any place, there will be wrist drop. Wrist drop is a characteristic feature of the injury to the radial nerve. And if there is injury to the musculocutaneous nerve, then your biceps and brachialis are affected now. Therefore there will be no flexion. There will be no flexion of your arm. There will be only extension. Therefore you will be having extended arm, plus there will be no supination. There will be pronation and pronation. Therefore you will be having an adducted arm with wrist drop and extended arm. This condition seems as if you are asking a tip from someone, and this is known as waiter's tip hand condition or porter's tip hand condition or policeman's tip hand condition. Guys, you may stop the video in between and you can just understand everything clearly and make the notes. Now let's see all this in an image. You can see that here this baby is having an extended arm, that is adducted. It is not abducted, it is extended and adducted. There is wrist drop, and you can see that there is pronation. So this was about the Erb's palsy. Now, another one is the Clomp Klc palsy. Now, Clomp Klc palsy causes. Okay, first of all, in this, your C8 and T1 are injured. Now, what are the causes? If it is by cervical rib, it can be caused by cervical rib, presence of a cervical rib. If it is done by cervical rib, then it is known as cervical rib syndrome. If it is done by the abnormal insertion of the scalene, anterior and middle scalene muscles, or spasm of the anterior and middle scalene muscles, then it is known as scalene syndrome. And if it is done due to abnormal breech delivery, then it is known as obstetric paralysis or birth palsy. Now, what happens in Clomp Klc palsy? Since C8 and T1 are affected, therefore, your intrinsic muscles of hand are affected, due to which there will be hyperextension at metacarpophalangeal joint, and there will be flexion at interphalangeal joint, and this is known as claw hand. You can see it is seeming as a claw, therefore it is known as claw hand. There is hyperextension at metacarpophalangeal joint, plus there is flexion at interphalangeal joint. And since your T1 is also affected, therefore Clomp Klc palsy is also associated with Horner's syndrome that we discussed earlier. That is sympathetic loss on the face. Now we can again relate it to a picture here, where you can see that there is hyperextension at metacarpophalangeal joint, and there is flexion at interphalangeal joint. So this was about the Clomp Klc palsy. These were some of the injuries related to the brachial plexus. And guys, if you have any doubt, you can just comment below in the comment section and I'll try to reply all of them. Thank you so much.